So the process of getting diagnosed with dementia obviously varies from person to person, but I think I'll try to concentrate on a sort of an outpatient diagnosis of dementia. And the diagnosis is made based on a history of progressively worsening memory or cognition, which is starting to impact on day-to-day life and functioning. And with that, there has to be objective evidence of cognitive impairment. So the symptoms have to be present for 6 months to make the diagnosis, and it's also important to exclude any reversible causes before making the diagnosis of dementia. Alzheimer's disease, which most people have heard of, and vascular dementia are the most common forms of common types of dementia, and they are the ones that present with the sort of symptoms that I think most people would recognise as dementia. So short-term memory difficulties, maybe forgetting names or forgetting words. So things that, yes, it looks like dementia as people think about it, but there are also some rarer kinds of dementia, Lewy body dementia and frontotemporal dementia, which can present quite differently. So Lewy body dementia presents with cognitive difficulties, but these can fluctuate and they can be accompanied by visual hallucinations, recurrent falls, symptoms of Parkinson's disease. And frontotemporal dementia can present either with a personality change and disinhibited behaviour, or with some very specific language difficulties. So having a dementia assessment really does depend on someone noticing the symptoms, and I know that sounds obvious, but noticing the symptoms and seeking help is not quite the same as some other conditions where people want to see a doctor, because in dementia, often the person may not be aware of their symptoms. So when they're unaware, it often falls to family members or close friends to raise the concern. So in Alzheimer's disease, relatives might notice, as I've said, short-term memory difficulties. They might notice that their relatives become more repetitive. They might think that they're not looking after themselves so well, they're falling behind in payments of bills, that kind of thing. So I would suggest if you see that, you should be talking to your relative to see if they're agreeable to an assessment, and to understand their views. I mean, if it is mild and there aren't particular risks, I think they need to understand that, how would they feel if they got an early diagnosis of dementia. The assessment process involves the doctor gathering information about the time frame over which the difficulties have developed, as well as their impact on day-to-day life. The doctor will ask questions about symptoms of other mental health difficulties, such as depression or anxiety, because these conditions can actually cause memory problems in later life, and so you might think of them as sort of almost reversible causes of dementia, or at least something that's compounding an underlying memory problem. There will then be a standardised cognitive assessment, which will vary depending on the doctor and depending on the person's background, etc., and pre-morbid educational level. But this typically takes between 5 and 15 minutes. And they're standardised tests which have cut-off scores according to age, which indicate an increased likelihood of the person having a dementia process. So that happens because people aren't always aware of the problems themselves, it's really important to give them an opportunity, give the relative who's with them or the friend an opportunity to speak without the patient or their relative present, because obviously it can be quite distressing, particularly for the person if they don't think that there's actually anything wrong with them. But it is important because it might be in that conversation that you understand that there are risks, or that things are much, much worse than the person is telling you in the appointment. After doing all of that, it will be important to check that you're not missing any physical health conditions which might be contributing to memory difficulties. So it's normal to organise some dementia screening blood tests to exclude things like hypothyroidism and anemia. So that will be done. And then if the history and the cognitive assessment are suggestive of a dementia, it is at that point usual to arrange a brain scan to try to identify the subtype of dementia, and also whether there are brain changes on scanning that support the diagnosis, and if so, what is the subtype of dementia. So it's usually an MRI brain scan, and that can show structural changes in the brain, which are supportive of either Alzheimer's disease, or it can show vascular changes in the brain, which might indicate that there is a vascular or a mixed vascular and Alzheimer's type dementia. If there's a suspicion that there's one of the rarer types of dementia, then there are different scans which might be required after or instead of the MRI brain scan. So once the assessment is complete and all the test results are available, the doctor then pulls together all of this information to make a diagnosis. And this will be discussed at a follow-up appointment with the patient, and hopefully with a relative who can support them and also remember some of the information. So written information is also really helpful for the person to go away with. But the discussion about diagnosis should include sort of information about what to expect, as well as practical approaches that might help, and advice about a lasting power of attorney, thinking about driving if the person is still driving and they would need to register, they'd need to let the DVLA know that they now have a diagnosis of dementia. It doesn't mean they'll necessarily have to stop driving now, but they would have to inform the DVLA. And also just starting to think ahead. I mean, that is actually an awful lot to do in one appointment, and it's a lot for someone to take on board. So that might need to be done over a couple of appointments. We can also, I would also talk about whether the person is eligible for or would want to start cognitive enhancing medication, and provide information about sort of local support services, etc., that they or their family could link into.